Hi, welcome back to my channel. In this video, I will be discussing around 3 diagrams of parotid gland that helps to solve most of the MCQs that come from parotid gland. So first of all, the first diagram is something, wait, so So first of all, let's just understand what I've drawn. So as you know, the yellow part that I'm highlighting is our parotid gland. All right. So starting from the labeling part. So first of all, we have the zygomatic arch. All right. Now from zygomatic arch, there arises the superficial lamina of parotid gland, and this is basically the paratidomasseteric fascia. All right. Now you have to remember superficial is the thick one. All right. And this is our investing layer of deep cervical fascia. All right. Now this is the deep lamina of parotid gland, and you should know that this is thin. All right. Just so that for a reference, I will draw this as thicker so that you remember superficial is thicker and deep is thin. Now here you need to observe that this thickens and it forms a thing which is the stylomandibular ligament. All right. So this is our styloid process. Now this is usually asked which part of the parotid lamina of the parotid gland forms the stylomandibular ligament. All right. So this is our first diagram. Just know this much, that thick and thin and so on. All right. Now let's talk about the relations of the parotid gland. Now for the relations, just observe this diagram that I'm drawing. So this is our parotid gland. All right. And this is anterior, this is posterior, this is medial, and this is lateral. Now to remember here, first of all, I don't know if you want to know the mnemonic or not, but it helps to remember. So MRM, and here we have PMS. Okay, MRM and PMS. All right. So suppose there's a lady Mariam and she is having premenstrual menopause. So PMS. Okay, you can remember it like that. So first of all, we have something like this. All right. So here we have two muscles. All right. So from just to go by the name of MRM. So M masseter. All right. And this is ramus of mandible, and again M, so medial pterygoid. So this is between anterior and medial. So these are the anteromedial relations, right? Then coming on to this one, so PMS. So again some structures which look like this. All right. Then again two muscles and a bone between them. So this is our bone. So from P we will start. So this is the posterior belly of digastric. This is the mastoid process. This is S, say, so sternocleidomastoid muscle. So this is between medial and posterior. So this is our posteromedial relation. Now one question is structures which traverse the parotid gland. So So this is our seventh nerve. All right, this is external carotid artery, and this is retromandibular vein. So these are the structures which pass through or within or traverse the parotid gland. Then here you have two more outside the gland. So ICA, EJV, external jugular vein. All right. So this is the relations. Okay. Then the last diagram that I need to tell you about. So in the last diagram, we basically go through it together. So let's just again draw our beautiful parotid gland. Now here you need to know two things, all right, to be rest assured that you answer correct. So first of all, you need to know, all right, so here you need to know the vein, artery and nerve relation. So just remember van. Okay, so we will just go through it. So first of all, we will have vein, then we will have artery, and I will draw the nerve with green. All right, or I should draw it with yellow. I'll draw it with yellow only. So nerve. All right, like this you have the relation. Then here again I'll just draw all the things and then I will label artery, and nerve. All right, then nerve, artery. Here it's different. Okay, here we are talking about the nerves only. All right, so let's just start. So first of all, let's go through this. So it's lying on the posterior. So posterior auricular artery, basically vessels, artery and vein, and nerve. All right, then anterior border, so superficial temporal. All right, artery, vein and nerve. Then this is important, this is auriculotemporal nerve. Okay, this is also prospective question. Then talking about these ones, so let's start from the down. So this is the anterior part, this is the posterior part of retromandibular vein, and this is the cervical branch of facial nerve. Now this is the question, structures exiting the parotid gland at apex. Okay, this is the question you should know. Then above the parotid duct and below the parotid duct, this is our parotid duct. So below we have lower buccal branch, then we have marginal mandibular branch and cervical branch. So these are the structures below parotid duct. Okay, this is also question. Then here just know lower is below, so upper buccal branch, zygomatic branch, temporal branch, seventh nerve key. All right, and this artery, very important, transverse, basically you can't see, just give me a second. So transverse facial artery. Okay, so these are the ones which prospective question, structure above parotid duct. So this is it, and I hope I made it easier for you to understand the diagrams. And basically just remember the diagrams and you are good to go. So if you like the video, do subscribe to my channel, and you can also comment on what topic you want me to cover. Yeah, so if you like the video, do subscribe to my channel. Thanks for watching.